we're going to talk about now for the next little bit is what happens to your health benefits when you retire from active service to the city of New York. There are some things to be concerned about and make sure we do correctly, dealing with both the Department of Education, Health and Welfare Office, with the Welfare Fund, and transitioning benefits from active status to retiree status. So the first page I have here is just a reminder for me of what I should talk about. And of course, the first thing is to make sure that you get if you haven't done so already and you're looking to retire, get a pension consultation. Contact the union, get a voucher for a pension consultation, schedule the consultation with whichever consultant you like. There are none that are endorsed, there are none that are on the payroll at CSA, but there's a number that everybody's used in the past, and everybody knows who they are. And offline, I can put you in contact with a couple if you're not sure of who to go to. The union will pay for 3 pension consultations for you. There's got to be 12 months between them. I believe if you're a member of the Elementary School Principals Association, NYSESPA, they pay for a 4th. If you've been back and forth, and should I retire and shouldn't I, and you've already used your 3 or 4, my personal opinion is go and get the 4th one or the 5th one, because you're going to be making decisions that are going to govern your financial existence and your quality of life for the rest of your life. And if you're retiring right at 55 or 56, that can be 30 or 40 years. So you want to make sure you make the right decisions and make the right decisions for your family. So the pension consultation is very important. The rest of this is just summaries you can look at. The whole retirement process starts by, once you've had your pension consultation, filing your papers with the Teachers Retirement System, TRS. They are still out of the office, so everything needs to be done electronically with them. This page here describes the process for doing that and the link to submit your documents. You go in, you identify yourself, you submit all your documents and paperwork. That gets acknowledged to you with an email. A couple of days later, you will arrange, and they'll have a consultation with a TRS representative just to go through, make sure that you've done everything correctly, you understand what you're doing. This is what you used to do when you walked in over on Water Street to the Member Service Center. So they're now doing it over the phone and online. Once they have that conversation, a couple of 3 days later, you'll get a TRS receipt. And we have a TRS receipt in there somewhere. Should have been the next one, right here. And what it does is it basically is dated and it says, Doug Hathaway, you filed papers. Your retirement date is 7/1/2020 or 7/1/2021 or September 1st, 2021, whatever it is. This is proof of when you're going to be retiring. So this is important to have this because you're going to need this with your health benefits paperwork down the line.
Hey, Doug, I can't see that picture. I see your checklist, but I'm not seeing the actual document.
Right.
Okay.
I was just going to let him know.
You're not seeing the document?
No.
No.
Do you have the materials I emailed you the other day?
Yes, I do. I can
Yeah,
look.
on the link. This is the same information that was on that link.
Oh, okay.
It's just that I put it here so that I know what I'm looking at and I don't have to waste paper and print it out. I have children that are very environmentally friendly and they hate it when they see my shredding pile. So.
Okay.
Oh, but we don't see your pages though. If that
You don't see the pages?
no.
No, you have
We
to,
don't see the pages.
you have to share the screen, unshare your screen now and then share your screen once your document is up on your screen.
Okay. Okay. Oh, okay. Hang on a second. We'll go do that. You think I should know this by now, right? When I talk to the retirees, all I do is just talk. So, okay. So this is on my screen. So now I should be able to go back over here. Share screen. Is that better? Oh, no.
That's it. We
Yeah,
can,
that, we got it. That's it.
Okay, great, great. Now, thank you, Rebecca. The look told me, you're the one on the top. I'm sorry. I'm going to be looking at you and, not that I don't mind looking at you, but I'm going to be picking on you and I'll be getting the feedback there. So if I really stink, I'm sure you'll continue to tell me. So thank
I
you.
got your back, Doug.
Thank you. Thank you. My friends at Renaissance always do. Anyway, so this is what the TRS receipt looks like. They'll email it to you. If you just pass that attachment on, usually we can't read it because it's in some weird format. So if you can just print it and scan it and send it along, that will work out fine. So this is the first part, is to get the TRS receipt. And the link for getting into the portal to do the documents and all is right here on trsnyc.org. Once you get that, you're now ready to go the next step and deal with my friends at the Department of Education. And what they're going to need is a health benefits application that we've got here, and we'll go through in a second, as well as a copy of your TRS receipt, because they will not process your benefits and switch you to retiree status unless they know for sure that you're actually retiring and when it is. So that's why the TRS receipt is the most important part. You get the TRS receipt, and then you get the health benefits application, which is this document here. And this is also on our website, I believe. I believe it's still on the homepage. You fill this out. You're still an employee, not a retiree. You put everybody in here. Put the dependents you're going to cover in box F. The most important question here is on the health benefit plan you want. Make sure that if you want to have a prescription drug benefit, you say yes to the optional benefits. You can also, just to make sure they get it, check it up here in box A. Our active welfare fund provides prescription drugs for you and your family while you're actively employed. We do not do that when you retire. So the way to get prescription drug coverage is to do it through the optional benefits rider. And we'll talk about the cost for that here in a second. So you would email those two documents. What I'm going to ask you to do is email them to us first and let us make sure you did it correctly. The Department of Education is not good about identifying problems. They'll just say, we can't accept it, the form is incomplete. Or what they often do is just say, your application was rejected because of, and then there's nothing listed. So now you got to try to track them down and find out why they rejected the form. So we will, my staff and I will look it over before you send it to the Department of Education. We have a special email address set up there for you, enrollment@csawf.org. Send us whatever you plan to send to the Department of Education. We'll take a look at it. We'll tell you if it's done right. We'll make suggestions. And then when it's fine, you can pass it on to the Department of Education with a copy of the TRS receipt. And that email address is here on the bottom, hrconnectbenefax@schools.nyc.gov. You will get a confirmation back that they've got it, and within 2 or 3 weeks, they should confirm that everything's in order and it's been accepted. Please save the email that you send them, or if you want to just send it to us anyway, the final version, we'll scan it, we'll keep it in our system, because mysteriously and for some strange reason, things have a way of getting lost between the Department of Education, who takes in your documents as an active employee, and then has to transfer them to the Office of Labor Relations, who administers benefits for the entire city and takes control of any changes you make when you retire. At one point, DOE wanted it done from a DOE email. I suggest you use your personal email, because if they don't get around to getting back to you until your retirement date, they've been turning off DOE email addresses like the day you retire lately. I've got people that have been retired for 10 years still using it, but within the last couple of years, they've been cutting them off on retirement date. So if something was going to that email address, we'd never know because the email address has been inactivated. So this is the part of the getting the city stuff done. We got this, we got the instructions. We also will need this form. CSA is different than some other unions. We have a separate, a completely separate benefit fund for retirees. So we have an active fund for our active employees. We have a separate fund for the retirees, which has separate eligibility, separate sets of benefits. And we need you to enroll in the retiree welfare fund in order to get those retiree benefits. Basically, what we need is a copy of this form filled out and a copy of the TRS receipt. We also need that because if the comptroller of the city comes around auditing and says, why are you giving this person benefits? They're not getting an active paycheck. TRS hasn't gotten around to finalizing the pension yet. How can you give them benefits? The TRS receipt proves that you're entitled to the benefits, and they know that at some point we'll get the contribution and the eligibility will be set up. So that's those are the documents. And again, you can email all of this stuff to either enrollment or to me, and we'll make sure it's right and we'll get it in and switch you over. I like this next page here, not because I was good with graphic design, but because it shows us the level of benefits we enjoy as CSA soon-to-be retirees. The bottom and the foundation of the coverage is your city-provided health plan. The City of New York provides free basic health coverage to all active employees and their eligible dependents, and all retired employees and their eligible dependents. As far as I know, only one other group in the country does actives, that's Los Angeles County Schools. We are the only retiree group in the country that does not contribute to our basic health coverage. We pay a little bit for the prescription drug benefit, the prescription rider, but we do not pay for basic coverage. The next one here, oh, perfect. Hey, it's actually where it belongs. The prescription drug benefit, like I said, is not covered by the welfare fund. It's covered by the optional benefits rider to your health plan. So if you look, these are the current retiree rates. If you're in the GHI CBP, the GHI health plan, and if you're only covering yourself, the optional benefits rider costs you $75.99 a month out of your pension. If you're covering a family is more than you. It can be a spouse, it can be 6 children, it can be a spouse and 6 children, domestic partner, whatever. Anything more than one is considered family. And for that, pre-Medicare, you pay $138.41. That comes directly out of your pension. It doesn't come out of your pension until the TRS finalizes the pension. So particularly if you're retiring the beginning of July, there'll be a couple of 3 months where they give you less than what your pension is. They give you an estimated amount. They call it an advance payment. It's typically about 80% of what they think it's going to be, just so you have something to live on.
Thank you.
And then when they finalize the pension, you get that month, you know, that of course they notify you, and you get what the correct amount is. You get the, let's say, 20% for the 3 months before. And if it took longer than a certain period of time, the back money they owe you gets reimbursed or earns interest. So that would all come at some point. Once you get that finalized pension, then the city starts taking deductions for healthcare. They will not do it beforehand. If you're a family coverage, $138 and change for 3 months is about around $450, $500. They don't take that all at once. They take it $35 a month until it's paid back. So whatever the pension deduction is for your health care is like an interest-free loan. You know, I don't know why they don't take it all back. If you're getting the lump sum of the money you should have gotten, you could probably absorb the lump sum for the health benefits. They choose not to do that, so they do it 35 extra. So if it's $138 a month and then take $35 a month, it's going to take 3 months of extra pension deduction to pay 1 month worth of pension of what it should have been, of the 138. So it takes a couple of years to pay this back. And every once in a while, people forget and they say, "What's this extra $35 on my stub for?" And then that's what it is. I think they now show how much you have to get to and how much is remaining on it on the deductions. I've seen that on some pension stubs lately. So this is what you pay, and it's whatever plan you're currently in. So if by chance you're in the Aetna EPO as an individual with a prescription, your pension deduction is $2,200 a month. If you're in the family in Aetna, it might be time, if you're not retiring in July, to switch health plans to something less expensive, because for a family with prescriptions, it's $6,700 a month, which is, you know, that's probably more than the pension will be, or close to what the entire pension is. So you don't want to be working to pay health premiums. There's a range of plans available. If you're in Aetna now and you retire and you see it's a burden, we can probably get you switched out of hardship. They're usually very good with us on that. If you're going to wait a little while, maybe change to one of the less expensive plans this fall during the transfer period, and then you'll have whatever you need when you retire. Basically, whatever health plan you're in now as an active employee is what you stay in as a retiree. An exception would be plans that have limited service areas, like the HIP HMO plans. You know, if you're in the HIP HMO plan and you decide to move to North Carolina, the HIP doesn't do you any good. So they let you change to a plan that you can use in North Carolina when you retire, but you have to show them proof that you're moving. So this is your only real healthcare cost when you retire, is the cost of the pension deduction. So that's a city-provided health plan. On top of that is the retiree welfare fund. The retiree welfare fund costs you nothing to be a part of. You're stuck with us in essence. If you're in the active fund, if you're covered by the CSA welfare fund as an active employee, and then you retire, then you're automatically covered by the CSA retiree welfare fund. If you're not yet close to retirement, and somebody offers you a chance to go to a management position that's not a union title, you have the choice of staying in the CSA welfare fund or going to the management benefit fund, which covers non-union employees. If you switch to the management benefit fund, then you have a whole separate set of welfare fund benefits. You no longer are covered by CSA. And if you retire from that position, you're then covered in the retiree benefit fund as retiree. We think we've got the best benefits for retirees in the city. So just as a caution, make sure if you are given that chance for a promotion, make sure that you stay in the retiree welfare fund. Again, this is free of charge to you and your eligible dependents. This is part of what's negotiated through collective bargaining. They negotiate a contribution to the active fund and to the retiree fund. CSA set it up so that active funds pay for active, retiree for retiree. And as a result, we have a very healthy retiree fund. On top of the pyramid is the retiree chapter. And the retiree chapter is a way for you to retain your union membership and show support to the union for what they've done for you while you've been actively employed. It's elective. You don't have to remain part of it. If you do remain part of the union by enrolling in the retiree chapter, there's a small pension deduction For an individual, it's 0.0035 of your monthly gross pension. If you join you and a spouse, it's 0.0045 of the monthly gross. Current active member dues are currently 1.5%. So it's typically $30, $35 a month. And one of the carrots to get you to join is a whole other set of medical benefits that supplement what the welfare fund does. So if the welfare fund pays a certain type of claim, then automatically the chapter does. And it's set up so that the checks just automatically come. You submit the paperwork to the retiree welfare fund, we process your claim, and if you're eligible for the chapter claim, we do that automatically, and at the end of the month, send you a check. For those who are getting close to maturity or are mature, maturity is defined as being Medicare eligible and 65 or older. When you're retired, you're not working, you're not covered by someone who is still working for an employer with more than 20 employees. Medicare becomes your primary coverage, and you pay the Medicare premium, whatever it is. Your city coverage then becomes a Medicare supplement. So Medicare typically pays 80% of the approved charge. The city plan will pay the other 20%, and then you've got the welfare fund and the chapter on top. So you got 4 places to get claims paid from. And to make it even better, as long as you're in a plan sponsored by the city of New York and you're Medicare eligible, the city reimburses in full anything you pay for Medicare Part B. So this year, that's the standard amount everybody pays is $148.50. If because of income you pay more, they call that IRMA, IRMAA, and then that is also reimbursed once you apply for it. So, basically all you're paying for is a prescription drug benefit, for the rest of your life, or whatever upcharge there is if you don't want to be in the base GHI plan, you want to be in one of the other plans. So, have I lost everybody yet? No? Yeah. No questions, I guess? Okay, let me keep talking.
I have a question.
Oh, there's questions. Good, thank you. I'm tired of listening to myself.
Okay, who's going, me or Mark?
No, you can go ahead. Go ahead.
Okay, I have a question. I have catastrophic from Mercer. I
Right.
took it long time ago and I still have it. The question here is, if I retire, let's say within a year or tomorrow, I'm 62 years, not 63 yet. So do I need this Mercer major catastrophic or not? Catastrophic major medical?
Yeah, no, I'm familiar with the plan, and it's an excellent plan, and it's worth having, at least until you're Medicare eligible.
Okay, once I'm 65, I don't need that
No,
plan,
but
right?
once you're 65, it's still worth keeping if you can afford it.
Okay, thanks.
What it can do is, did you get there from NYSA when you were first a teacher?
That is correct, yes,
Okay.
many years ago.
Okay, yeah, they changed the plan several years ago. And what it is now is if you use a participating provider, and you have more than $2,500 worth of unreimbursed expenses, then you can submit it to them for reimbursement. And that deductible resets every year. It seems like a lot, but if you're in the GHI health plan with the GHI drug plan, there's a big gap. You have to meet the true out-of-pocket amount, which this year is over $6,000, before we can provide any reimbursement of copays. So the difference between the $2,500 and the $6,500, that plan could reimburse you.
Okay.
So okay,
Yeah.
and that's per person. They also have in that plan additional home health aid benefits of about $60,000, which you can use beyond ours. And they provide about $90,000 worth of help if you're in the nursing home. Now, $90,000 in the nursing home won't last long, but it's just to fill in around whatever other coverage you have. So if you can afford the premiums, it's worth keeping, because once you drop it, you can't get back in.
Right. And the premium is not very high. It's every half a year, about $200 or $300, something like that.
Yeah, no, I would keep it if, yeah,
Thank you. Thanks a lot.
yeah.
Hey, Dr. Hathaway, I have a question about if I retire and move to another state, let's say Florida. So what a lot of the health and doctors do not participate in the emblem health.
Correct.
So is that my only option until I get
No,
to 65?
You could switch to any of those other plans that we just saw over here. Like up here, are you an individual or family?
Family.
Family, okay. So let's say you went to an Empire gated EPO. That's like like an HMO plan. It's Blue Cross Doctors, which makes it a little better, but it's still, you have to pick a doctor, you got to have referrals and all of that. That's going to cost you $1,600 a month for
That's a
12
lot.
to cover your family.
That's a lot.
Right. So if you stay in the GHI, that would cost you 138. The welfare fund has a stop loss benefit. And what that benefit says is if you have $1,000 of unreimbursed expenses, well, once you have a thousand, the next 1,250 we reimburse at 80%, and then at 100% to a maximum of 50,000 a year, $250,000 lifetime per person. So $1,250 is the maximum out of pocket per person. So how many people in the family?
3.
3. Okay, so that's like $3,750, right? Or $3,775, somewhere around there. So for $3,800, worst case scenario, you can stay in GHI anywhere you are in the country. If you go to that Empire EPO, a gated EPO at $1,600, right? After 3 months, you'd be, it would be costing more. So it's your decision, but people who are in your situation often will use our stop loss, because that way it's if you have those major costs, you're limiting what the costs are. You're not throwing money out in an insurance policy that you may not need.
So the union would pay after I pay for each person $1,200.
Well, after $1,000 per person, we're going to start helping you and start reimbursing.
That's only if you're. What about if you're not retired and I'm not in the state? You do that also?
Yeah, we do the same thing anyway. We do it now.
Oh, I didn't know about that.
No, it's an active benefit too, but the deductible is $1,500. So if you use non-GHI providers, if you're one of the 8% that doesn't use the GHI participating provider, GHI is going to pay. You have this one doctor you think is fantastic. The doctor charges $600 a visit, and GHI pays $39.
Yeah.
Well, the difference between the 600 and the 39 is $561 or whatever, and that $561 would count towards your catastrophic deductible. So wherever you are, GHI after their deductible is going to do their reimbursement, but hopefully you stay healthy until you're Medicare eligible.
So and then when I am 65, I can look at the second table, yeah, which is
when you're Medicare eligible,
yeah.
then you look at the monthly Medicare amounts, and what that is paying. Basically, it's a prescription drug for GHI or HIP. Okay, the basic coverage, that's your free basic coverage. The benchmark plans are GHI Senior Care and the HIP VIP Premier. Any other plan, but MediBlue is $0 also.
No, but I'm sorry. I mean, a lot of the doctors take the Aetna and the Cigna. I can go to Aetna.
No, a lot of doctors take Aetna or Cigna, But again, you're paying $600 a month for the privilege of being in Aetna. Any doctor that when you get to be Medicare eligible,
Yeah,
you can go to any doctor who accepts Medicare, and GHI will pay the 20% that Medicare doesn't pay.
okay,
Once you get to be Medicare eligible, there's no such thing as a GHI doctor.
okay, and then what, that's a 60, and then what if my wife hits the 65 before me?
Well,
Does-
then she gets that coverage and you get the non. So your pension deduction would be the $150 for the senior care here. And then it would be, then it would be $75, $76 for you.
Okay,
And then you can join her in maturity and it would be $300 a month.
okay, you follow that?
Did I confuse you?
No, she's following with me, she's smarter than.
Good.
Okay, very good. Thank you, no, I get it, thank you.
Okay.
Can I ask a
Yeah,
question? Doug?
absolutely.
So in your experience, how does the city optional rider for drug costs compare with other Medicare supplement plans for drugs that are out there, like ARP and various other?
The city Medicare drug, the GHI enhanced drug plan, your cost is 25% of the cost of the drug.
Okay.
Okay, so if you're on low cost generics, it's not bad. It's a pretty good deal. If you if you start needing some of the very expensive brand name medications they advertise on TV, you know, like Eliquis, like insulin, like Trulicity, like Bydureon, like any of the, you know, a lot of the injectable diabetic medications or other injectable, the Enbrel, Humira, those get up in a little bit in cost.
Okay.
And if you're in the senior care plan, you're identified as being a CSA retiree, so we pay for the extra hospital benefit that's in there. There's a 365-day hospital benefit. That's what the dollar is. Big of us, right? But it used to be $250. But the reason we did it over 20 years ago was just for that reason, because at that point, a lot of our members had a spouse who had health coverage from a private business, you know, the financial services, but they used to provide health care to retirees at a reasonable cost with drug plans, and the copays were less. So everybody wanted that drug plan, but they didn't want to give up the hospital benefit. And since it's an all-in-one, back then it was close to $200. So we negotiated with the city and they let us pay that for people. So you won't lose anything under the senior care plan if you go to a different plan. I personally, since I'm not a city retiree or employee, I have an AARP plan that I'm very happy with.
Okay. All right. Thanks.
Can I ask you a few more questions, Doug?
Absolutely.
Okay. First question, if you're not 65, which I am not 65, and I retire and I have GHI plan, currently GHI is only to visit doctors and Emblem Health to visit hospitals.
No,
So-
no. GHI is Emblem Health.
Oh, no,
You
no,
see-
sorry, not them, I'm sorry, Blue
Right.
Cross Blue Shield Hospital. Yeah,
Right,
sorry.
right, yeah.
Blue Cross Blue Shield.
Okay.
So what's going to happen when I retire with hospital plan? It's
Nothing.
going to be under Emblem Health or,
It's the same thing. It's the same thing you have now.
okay.
Yeah,
So Blue Cross Blue Shield will be the coverage for hospital till I'm 65.
Yes,
And when I'm 65, it will be 20% after Medicare.
right. But
Again.
then if you're in the city GHI senior care plan, you
Okay.
still have GHI to supplement doctors and laboratories,
Yeah,
and Blue Cross to supplement hospitals and skilled nursing or rehab. So
okay,
nothing really changes.
okay.
You know, it's still a $300 deductible when you go to the hospital with 2.5 deductibles a year maximum.
Okay, yeah, so, and going back to what Rebecca asked you about, and you responded 25% for prescriptions that we have to pay. So in my case, if I have major catastrophic, will that cover that difference, or does it fall under
Yeah.
catastrophic?
Once you meet their deductible,
Mhm.
So let's say your prescription's $1,000, you know, and you have to pay 250.
Right.
You know, that's $250 out of pocket. So once all the other pockets add up to $2,500, then you can submit the drug copay charges to the Mercer plan, and they'll reimburse them.
Right, and within the same line, when another question was asked, and you gave that example, so there will be a difference when you visit out-of-network doctors, $561 per visit. CSA will reimburse once you meet that deductible, right? 1,200 or 1,500.
Yeah,
And
after you meet the $100, $1,000
$1,000,
deductible. Yeah,
then it will be reimbursed by CSA and
Yeah.
also can be reimbursed by major medical catastrophic, right?
Catastrophic is gonna, they know about us, they're gonna wanna see what we pay.
Uh-huh.
So the $1,000 deductible and the 250 we don't pay out of that first 1,250.
Mhm.
You know, you can submit to them for consideration, but they know the CSA exists. They know the
Okay.
retiree chapter exists, but they still call them by their old name after 15 years. So
Right, just simply need to know, so it goes to you, not to Mercer first when we go.
right, go to
up the
us
south.
first.
Yes.
Correct.
Mhm.
Yep.
Thank you very much.
Okay.
Doug, I have a quick question.
Okay.
You mentioned before when you were talking about the health plan and prescription drugs that the health plan is exactly the same as we have now with the additional where we would take the rider for the
Right.
family 138, including prescription. It just so happens that something you mentioned about Humira, my son actually is mild Crohn's and takes Humira now. And right now we're on a, whatever the deductible is now. Once I retire, is it still the same or are there
Yeah.
additional costs?
You're getting that through the PICA program now,
Right.
and PICA program will continue until you're 65.
Okay. Thank you.
So you'll keep that benefit.
Thank you.
You know, if he's still on cover, well, he will always be eligible for it because he won't become Medicare eligible.
Right. Yeah.
Unless,
Exactly.
unless something strange happens here in the next couple of years.
Right. Okay. So the PICA still exists.
Yeah, the PICA still exists pre-Medicare.
Okay.
You know, once you're 65, that goes away and everything's, the New York State mandate that the health plan cover the diabetic medications and testing supplies, that goes away when you turn 65 because Medicare rules, pardon the expression, but they're the 800-pound elephant in the room. And whatever they say, everybody has to comply with.
Comply with.
Yeah.
Thank you.
Okay.
Doug, I have a question.
Okay.
I'm currently using my husband's insurance. He works for MTA, State Insurance Empire Plan. So would it behoove me to get my own insurance under our plan as he will retire before I will?
Yeah. Let me ask one question. Do you have any dependent children cluttering things up around the house?
One that will soon be off, 24.
Okay. The reason I mention that is because the city recommends and we recommend that if both members of a family, both adults in the family,
Yeah.
are entitled to have coverage in their own name, once there's no dependent children that need to be covered, it's just two people getting covered. You each have your own coverage. Because if you remain on his coverage and he let's hope that doesn't happen, but he predeceases you, then you're without coverage until you now come back, fill out paperwork with the Office of Labor Relations, which is still basically remote, and try to reinstate the benefits that you're entitled to.
Got it.
So,
Okay.
if you don't have benefits now, you can always go in and we can help you with the DOE getting them reinstated
Okay. Thank you much.
when he retires.
Okay.
One more question. So are the health benefits for retiree under the discussion with this retirement incentive? So meaning some of these things, benefits change?
No, the early retirement incentive has nothing to do with healthcare benefits. There's a separate discussion going on between the unions and the city. We're negotiating a new type of health plan for Medicare eligibles that is targeted to save $600 million a year in healthcare. Yeah, if you think back to the last 8 years, we've already committed to saving. The first healthcare savings agreement was like 3.1 billion. The one we're on now is 2.1 billion. That's why copays with GHI went up. That's why the emergency room deductible went up to 150. That's why they've been encouraging people to use the Advantage Care Physician Group by enticing them with no copay for regular or specialist, because that group is very tightly tied to Emblem Health, so they can control the cost there. And if they keep the cost down, that benefits the city. So all this has affected those of us who are still actively employed. Nothing has happened to the retirees, so they're trying to come in and find a new benchmark plan, something to replace the senior care plan. And that will be pretty much, identical to what it is now, just a different name, organization. Medicare helps fund it, so that is projected to save the 600 million. But you'll still have free basic health care, as long as you live.
Okay, thank you.
Okay. Okay, anybody else? Okay, great. This is great. This is almost as much fun as being in the classroom together. I'm glad it turned out to be a smaller group. Hopefully the people that are on here are not here because they didn't get the email link, because actually those links came directly from my email, so there's no excuse for going into spam. The other ones sometimes go into spam. So the next thing here is just something from the City Office of Labor Relations that we put in. It describes, what you need to do. When do you contact them? When do you contact your union? Just some things here as a reference. I will tell you that dealing with and getting a hold of the Office of Labor Relations as a retiree is almost as much fun as getting a hold of the Department of Education. So, if you have issues as a retiree dealing with the Office of Labor Relations, please let me know. I'll be your advocate and we'll get things straightened out for you with them or with the health plan, just as we do now. It's been a struggle, but we have good relationships with all the health plans. And if we go in and ask for assistance, we usually get it fairly quickly. The next thing I put in is just a little description of nursing home care or long-term care. This is something that you don't have anywhere in current benefits or in retiree benefits. It's not covered by the city either way. Medicare doesn't provide long-term care benefits. The welfare fund doesn't provide long-term care benefits. So if you're interested, now is the time to look into buying it when you're younger. The younger you are, the cheaper it is. And the last I saw, a semi-private room in a decent nursing home around New York was between $175,000 and $200,000 a year. So that's more than the pension will cover. You also need to think that if you're the one that has the pension, and when you do your consultation, you take a reduced amount so your spouse or partner will get something if you pass first. Well, that's what they're living on. And so that's not going to be enough to cover nursing home care. It's worth looking at. The catastrophic plan we talked about has minimal support for it. So what we recommend is look into long-term care. There are two plans that the CSA union has endorsed. If you log into the CSA website, go into the member section under member benefits, there's a section there on long-term care, and go in there, take a look around. Our representative is Eleanor Packer, Ellie Packer. Her contact information is there. And she is excellent. She will talk to you until you're blue in the face, make sure you understand everything. And if the plans that CSA has endorsed really don't fit you, she represents a number of other plans that can get you a decent discount off that. The reason I say do it now is the older you are, the fewer number of years you have to pay a premium, so you pay more per year. Some of the things to think about when you buy it are what type of inflation protection is there, because costs keep going up. If you go in and say, I'm going to buy a policy that will take care of my expenses today, which let's say it's $350 a day. Well, in 20 years or 30 years, when you need that, how far is $350 a day going to go? So you want either to purchase something that automatically adjusts for inflation or gives you the option to buy additional inflation coverage like every 3 years. 20 years ago, CSA endorsed the plan through MetLife. I was able to get in on that because I was an employee. There was no underwriting, so if you could breathe, they'd take you, thank God. With my pre-existing conditions, I wouldn't get it any other way. And what I could afford at the time was $250 a day for my wife and I. And every 3 years, over the last 20 years, we bought up the inflation factor. It's up close to $500 a day now. The premium's gone up also, but I've already got the 3 kids through college and grad school and law school. So now I can, I've got the money that was going to them. I can pay for long-term care. So, it's like you buy it when you can and what you can afford, but having that inflation adjustment is fine. Every time it comes along and says you can buy the inflation or we can cap it at what it is, I'm fortunately able to keep paying it. What started out is maybe $150 a month for the 2 of us is now up to $600 a month. But I can afford it now, so we're able to do that, and it's just one less thing we have to worry about. So take a look at it. If you have trouble getting a hold of Ellie, let me know, and I can maybe find the help and track her down.
I just wanted to say that I decided to go with that, and I've been speaking to Ellie. She's excellent. She is so precise and really attentive to all of your needs. She's excellent.
Yeah, she is, and she wants to be part of these workshops, but from what you've said, I'm sure you know also, it would become the Ellie Packer long-term care workshop with brief appearances by Doug talking about health benefits. So I haven't gotten to the point. Especially on Zoom. I would hate to have to drop her connection or something, but she's a sweetheart. She's wonderful. I think she's at, I don't remember if she's at the CSA conferences or not. But I'm glad you had a good experience with her.
Yeah, I decided to do it before I retire to get the long-term care. Yep. Thank you.
Okay. Okay, now the next thing I got here is a little assignment for you. We call it the Survivor's Information Guide. And what a lot of the calls that my staff and I get and the retiree chapter get are from a new surviving spouse. So they're the spouse of a member who just passed away. It's usually like he or she did everything. I have no clue. What do I do? It used to be some would call and say, I don't even remember how to write a check anymore. He wrote checks and paid all the bills. So what we did in conjunction with the retiree chapter was put together sort of like a beginning of an outline of who you should call and what type of information you should have available for those who will follow you. The first thing on here, the first couple of pages are what groups do you need to contact. So the first one, of course, is the Teachers Retirement System in New York. If you have an option on your pension where your spouse or partner as a survivor will get an allocation, then TRS has to know, and they have to recalculate the pension to reflect the fact that you have passed and now it's on the survivor portion. And unfortunately, we don't always die on the 1st or the 31st of the month. If we did, it would make it easy for TRS. But if I die on, I hate to say this, May 15th, you know, I hope I live longer than 2 days. But if I were to die on May 15th, by the, you know, at the end of the month, TRS is going to send me my normal pension check and put it in the bank account. But that's incorrect because I've been dead for 2 weeks. So my wife would needs to notify TRS, send them an original death certificate. They can recalculate the death benefit, the pension benefit, and put the money in. They will come in and they'll take what they've paid incorrectly out of the bank account. So that's why this is the first thing. You know, if you wait 6 months, if the survivor waits 6 months, then TRS is going to come and try to get 6 months worth of pension back. Good luck on that. But that's why this is the first call. If you're a member of the retiree chapter, they have staff who can assist you and cut through the red tape and the slowness over at TRS. The next group that needs to be contacted, we listed here. However, you can call us instead, but the Office of Labor Relations needs to know, because if you're the one who has the benefits and your spouse or partner was not a city retiree, coverage dies the day you die. So they're now without a Medicare supplement. They're entitled to continue your coverage through COBRA for three years, but this all needs to be done. So if we get a copy of the death certificate, we can give that to Labor Relations. We can get the COBRA application for your survivor, send it to the appropriate health plan, and make sure that they're not without coverage. Social Security needs to know so that they can stop Social Security payments. Typically, funeral homes do this. Talked to a gentleman earlier this week whose wife just passed away, and whatever funeral director he used didn't notify Social Security. So he had been on the phone for an hour and a half trying to deal with this, and the pain of losing his wife, now having to deal with Social Security. So, you want to make sure this gets done. And then you call us, Welfare Fund and/or Retiree Chapter. We can help with the transitions. That's what we're here for. We're a member service organization. You're our members, you're our participants. We're here to help you. And more importantly, we take a special interest in those you leave behind, your spouses, because we know how supportive they've been of you, and they now need that same support. So what type of information are we looking for? We want your real date of birth. Ladies, not the one you've been telling everybody for all these years. Men don't lie about their age. Women sometimes do. Place of birth, where's your birth certificate? Social Security number, where'd you last work? When did you retire? What's your pension number? What was the option? What's your TDA number? Who are the TDA beneficiaries? What's your health plan? Spouse's health plan, if there is one. Any other organizations that you have benefits from? You might have a life insurance benefit through a college alumni association or something. So you need to put all these things down here because these are all people that need to be contacted. Where's the original will? Who have you been using for an attorney? Who's the accountant? If you served in the military, you need to let them know because they can have a military presence at your service. Number 7 is where it gets fun. This is where you have to come clean and where you've been hiding the money for all these years. What cookie jar, what offshore bank account. On one of my trips out to a benefits conference or the retirees out on the West Coast, I got hooked on Storage Wars, on History Channel, I think it is, or one of them, where they buy the storage lockers, and they bid for the storage lockers, and then they go through. And there was one I still remember. The two guys bought a locker, and it was junk. It was just absolute, even I knew it was junk. And then in the back, they saw this big gilded picture frame. And so they brought it out, and it was, the picture was like a velvet Elvis or a dog shooting pool or something, nothing anybody would ever want. But they figured the frame might be worth $5 in the thrift shop they ran. So they took it out in the hallway. They tore the paper off the back of the picture and taped to the back of the picture were 19 $100 bills. So they were very ecstatic and very happy that this junk locker gave them $1,900. And I'm happy for them. But I really would like to know who put the $1,900 on the back of the picture and abandoned the locker. Because if they abandoned the locker, they probably could use the $1,900. So the point is, let everybody know where it is, the account numbers, if you have a safe deposit box and everything, who you deal with for investments, what life insurance do you have, anybody else that needs to be contacted. What I'm going to do at some point, I keep promising this, is we'll put on here a list of, where are your passwords? Because if you do banking online, if you order stuff online, if you, look up health claims online, you've got a user ID and a password somewhere. And this is like a case of the shoemaker's children, because my wife keeps telling me I need to do this. And I go, yeah. And I still haven't done it after all these years. So this is something we put together. Feel free to use it all you want, expand upon it, print off all you want. It's also on the website if you want to give it to friends. You can pay $20 to get a 4-color glossy version of this, but I really don't know why. This will give you the basic information. And I always tell a story, and I'll keep it brief because I know this was the day off. But my mother was a retired Latin and English teacher who continued to live up on the coast of Maine, where I was born and raised. I was the principal's kid. So my father was the high school principal. I had him as a history teacher my freshman year. And I guess who had 4 years of Latin? That was me. Yeah. So, after my father passed away, my brother and I decided that we should go up for her birthday more and see her more often. So we started going up for her birthday, which happened to be February. So when you're on the coast of Maine in February, there's not a whole lot to do other than watch the snow melt. So we were watching a golf tournament from California in the living room. She comes into the living room with a piece of loose leaf notebook paper, handwritten, half a sheet full. The top of the form, it said, "What to do with my stuff." Literally, that's what it said, "What to do with my stuff." And then the first one was a ring that was her mother's that was supposed to go to my cousin in Houston and all. And I looked at it and said, "Mom, this is great. Thank you. I've told you how many times it's frustrating when I deal with survivors and all." I said, "But you got to tell me one more thing." And she goes, "What's that?" She says, I say, "You got to tell me where you're going to put it. Because it's one thing to prepare the paperwork, but it's another thing to let people know where it is." So she looked at me like I had 3 heads, said, "In the blue metal file box, of course." And then I remembered my father had this blue metal file box he kept in his desk. I had a combination on it, probably to keep people out, but he left it 000, so it wasn't too hard to get in. And he had life insurance policies, car insurance policies, and everything, plus his private stash of chocolate bars that he didn't know my brother and I knew where the chocolate bars were. So every once in a while, we'd sneak in there, have a piece of chocolate, and he'd go in after a couple of weeks and he'd say, "Where'd all my chocolate go? I don't remember eating all that." And then he'd ask my mother to buy him more, and she'd buy him more, and then we'd have another supply of chocolate bars. So, the point is, that's where it was. So, several years later, she's in the hospital for a month trying to get some surgery done, and she just doesn't make it. She passes away on the Saturday morning. My brother calls me and says, "Doug, Mom passed away. What should we do?" And I was getting my first daughter, my oldest daughter, ready for college on Wednesday. So we said, well, let's get Chelsea to school and then we'll come up to Maine. So, okay. He says, I've got mom's list, we'll work from there. So we got my daughter ready for college, got her to college, came home. Next day, we all drove up to Maine, did the viewing, did the memorial service and all. And come to find out, the half a page was now 8 pages, double-sided. It didn't fit in the box anymore. It was in a blue folder. And she had added quite a bit to this document. She had the order of worship for her memorial service with and without a choir. You know, because remember, she's on the coast of Maine, and if she passes away in the middle of the summer, when all of the townspeople are there making their money for the 4 months that people go to Maine in the summer so they can live the rest of the year, she had a real concern that maybe the church ladies wouldn't be able to get off from work and sing. So it was with and without a choir. Plus, we had a brand new pastor who had maybe met my mother twice and had no idea who she was. So she had the memorial service there. As it turns out, we did get the church ladies to sing in the choir, which I can still remember. And more importantly, she had added in there all the different places where she had investments, mutual funds, annuities, or whatever, with a contact person. So we went, we had the memorial service. We called the people up. They sent somebody to the house the next day. And since we were both there, we signed all the paperwork right there. And it just made everything so much easier to know that we did everything the way she wanted it. And also to know that we were able to get all the paperwork done without passing it back and forth through the mail. So, you know, it's something that's really worthwhile. And somewhere, one of these years, I'm going to put a copy of the blue metal box in the materials here because it still exists. I found it when we were cleaning out my mother's house finally. And I told my brother this story. He watched the video and he said, why did you mention it at the end? I watched 2 hours of you talking about benefits and then I saw that. He says, I've got the box, but I changed the combination so you can't get into it. I said, thank you. And he said, yeah, I changed it to 001. So the point is, you know, have this someplace where it is, where people know where it is, and put the information in there that they will need. I didn't get a chance to look at everybody's demographics. Is there anybody here who is already over 65 or who has a spouse over 65? Yay or nay?
I have a spouse over 65.
Okay. And so what you would need to do before you retire, if you haven't done so already, is you need to first get the TRS receipt and then complete the top half of this document and send it over to the Department of Education. What this is this is a document that when you take it to Social Security for him to sign up for Medicare Part B, he's not penalized for enrolling in Part B after age 65. So the employer name is Department of Education or New York City. He's the applicant, you're the employee, and then they fill this out. So you would fill this out, send it with a copy of the TRS receipt by email to the Department of Ed. They'll take a while, and when they send it back, they'll fill out the bottom here and email it back to you, and then you can go and take it to Social Security to get him signed up. The other alternative is to have a payroll secretary do it if you're on good terms with them. They get cranky sometimes if payroll secretaries do it, but now that everything's by email, you know, that would speed things up a bit for you.
Question, Doug, what if his spouse is currently 65, but I'm not near there yet?
No, you would need this for your spouse.
So he's 65 now. He would have to fill this out.
Right, you would need to, you would need to get this filled out for him just before you retire, so that, because, when you retire, and they see that he's already 65, the city will assume that he's on Medicare primary, and that they'll be secondary. So they're only going to pay 20%. So you need Medicare to pay their 80%. And you want to do it in such a way that you're not penalized for a late enrollment.
Okay, thank
Okay,
you.
he may, he may have signed up for Part A when he first turned 65,
He
but
did.
Part B you have to pay for. And when you work for a company with more than 20 employees, Medicare says we're secondary, so you're paying hundreds of dollars a month for something you're not using, and they know that. So that's why they have this provision for you to go in, enroll after 65, but not have to pay a penalty.
Okay, thank you.
Okay. Okay, so that's that. Now for the good stuff. Yeah. But everybody's still here too. Cool. Yeah, I haven't driven you off yet. This is the good stuff. This is the stuff I could talk about all day. What this next two pages are the welfare fund and retiree chapter supplemental benefits you get once you retire as a CSA retiree. The column for the retiree welfare fund, which this year is green, this is what comes to you free of charge because you're retiring as a CSA member. If you elect to be part of the retiree chapter and pay that 0.0035 or 0045, then what's in it was supposed to be pinkish, or I guess fuchsia, whatever, but the pinky purple column here, that's what you get for that extra little bit every month. So I'm going to spend some time going through this. If you have questions, let me know. Time for my daily robocall and spam call.
Doug, excuse me, I
Yeah.
didn't see that form in the package. I'm looking through the package, but I don't see that form, this form. I don't
This
see
one?
this one.
It should be there. It would be.
I'm gonna look through it again.
Okay,
Okay,
if you don't find it, let me know and I can email it to you separate.
okay, thank
Okay.
you.
But yeah, I'm going through the same materials that I emailed everybody, so.
Okay, got it, got it.
Okay,
Was in
great.
a different place.
Okay. So now
Thank
with the, okay, great. So with the benefits, we'll go through these, indicate what's different and what's improved. With dental, we continue the two plans you have here in New York, the SIDS plan and the HealthPlex Dent Care plan. We have a Delta HMO plan available in a few states where SIDS traditionally has not been, like California, Arizona, Texas, Georgia, Virginia, New Jersey. American Dental of Florida is a discount network. It's basically HealthPlex of Florida. But what you need to know is that the SIDS plan now gives major coverage wherever you are in the country. SIDS is contracted on our behalf with two additional networks of providers. There's one group that tends to just be a little further outside where SIDS usually has their participating providers in the New York, New Jersey, Connecticut, Pennsylvania area. That group's called MetroDent. And then there's a nationwide network that we used to offer to people that they would buy into for about $50 a person a year, called Carrington. And Carrington has over 100,000 dentists all over the country. So no matter where you are, you don't have to pay, pardon the expression, bust out retail for your dental. You can always find a discount. If you're in the greater New York area, there's even more SIDS dentists than when they are as active because we have a bit higher reimbursement level. So you can go to a SIDS dentist. There is no deductible, there is no copay with SIDS, and there's limited support for implants as a retiree. We'll pay $600 for placing the implant like 237 for the abutment and then 437 for the crown. If you go to a participating provider, what I just said is what you pay, and we pay the same amount to the provider, so we're splitting the cost with the provider. If you go to a non-participating provider, we still provide that same reimbursement. Like I said, if you move away from New York and you go to a Carrington dentist and you need a crown, their charge for a standard crown is like $750. If you go to a dentist who's not affiliated with anybody, that crown can be, they can charge you anywhere from $1,500 to $2,000. So they're already charging you a greatly reduced fee. We reimburse $500 towards a crown. So if you go to a Carrington dentist, your out-of-pocket cost for that crown is $250. You go to an unaffiliated dentist, we're still paying you the $500, and you're paying the dentist the other $1,500 or $2,000. If you go to the SIDS website, which is asonet.com, indicate you're in the CSA Retiree Welfare Fund and do a provider search, the providers will come back color-coded so you know which group they're part of. If they come back listed in blue, that's a traditional SIDS participating dentist. If they come back in green, they're MetroDent. If they come back in red, they're Carrington. And also, when you do that search, you can look and see what the charges are and the reimbursements are for the MetroDent and the Carrington to help you make a decision. If you're going to Carrington or MetroDent, tell them you're part of ASO, Administrative Services Only, because that's SID's parent company. And that's the one that is contracted with these various provider networks. The retiree chapter, where it says under development, because the chapter still doesn't have the resources to provide a meaningful supplement. The last time we looked, they could afford maybe $20 a crown, but it would take $10 to get the information, process it, and mail it. So why spend $10 to send 20? We said, put your money somewhere else, and they said, okay. So that's dental. Now with the optical, we continue with the vouchers. You can go to any provider you want. We did away with participating providers 6 or 7 years ago. We increased the reimbursement to $100. And so you can go anywhere you want to. You can go to Costco, you can go to Warby Parker, you can go to Cool Eyes, whatever you want. We still, a voucher is required once every 12 months. Tell us you want a voucher, we'll print the voucher, we'll mail it to you. Sign the voucher on the bottom, send it back with an itemized copy of the receipt, and we'll give you the $100. Now, if you're a member of the retiree chapter and you spend more than the $100, then at the end of the month that you get our welfare fund check, you'll get another check for up to $65 from the retiree chapter automatically. We do all the processing for them, and we designed it so that you didn't have to resubmit paperwork. If I'm sending you a check from 40 Rector Street, why do you have to send a copy of that back to 40 Rector Street so somebody can give you another $65? It's a lot easier to do it all in one place, and it also helps make sure that your personal information is in only one place and only on one system, not spread throughout the organization. We have a benefit as a retiree for a visual aid machine. This used to be, and still is, like a full-page magnifier. If you have trouble with macular degeneration or something, or your eyesight's going and you need things enlarged, it blows it up so it's able to be seen. Laser vision, we continue this. We have this for you as an active member. If you want LASIK surgery, we'll provide a reimbursement of $500 once in a lifetime. As a retiree, if you haven't had it done, it's still $500. The multifocal lens, as we get mature, we often develop cataracts. My eye doctor, every time I go in, he says, they're not ripe yet, they're not ripe yet, they're not ripe yet. I used to tell him, wait until I'm Medicare eligible so I know it'll get paid for. I've only been back to him once since I hit that magic age. I'm due to go back, and hopefully I've got a couple more years before I need the surgery. But what the latest and greatest technology is in cataract surgery is what they call a multifocal or a toric lens. And the theory behind this is that if you get this lens implanted, you don't need reading glasses or distance glasses like you might with a traditional single vision lens. Up until the last 4 or 5 years, Medicare didn't pay anything if you had a multifocal lens. They now will pay the equivalent of a single vision lens. So there is an extra charge of anywhere from $1,500 to $2,000 per eye for this fancy lens. And we will, upon, you send us the surgeon's bill and the explanation of benefits from Medicare, we see that you actually did incur this extra expense, and we'll give you back the $500 per eye. Hearing aids, we continue our hearing aid benefit. We have the same benefit for the active members, $800 once every 3 years. And not surprisingly, we don't do a lot of active member hearing aids, but we do a lot for retirees. And I finally figured out why. Because if you're an active member and you can't hear things, that's a good thing. But when you're retired and you can't hear your grandkids or your spouse, that's a bad thing. So it's nothing to do with our hearing deteriorating with age. It's just a matter of what you want to hear. So the welfare fund will do a reimbursement. Again, we want a voucher. Ask for a voucher. We'll send you the voucher. We do it once every 3 years. We'll send you back $800. And then at the end of that month, most hearing aids are more than $800. So the retiree chapter will kick in another $800, and that will come automatically. That's hearing aids. Oh, home health. So for home health aids, this is a benefit we put in back maybe 15, 16 years ago. As we mature, there get to be times when we need some help getting around. This was originally the thought of you're in the hospital for surgery. They throw you out as soon as the bleeding stops when you really aren't strong enough to be home. So now you're home and you got to take care of yourself. If you can't do it by yourself, or if you can't do it with the help of a spouse or partner, you may need to hire an aide. So what we do is we will provide reimbursement of up to $10,000 a year, $30,000 lifetime for your expense, to reimburse you for your expenses for having a home health aide. We ask that there's a little form, simple form for your doctor to fill out and certify the need for the care. Then what we do is we want you to hire an individual aide or a nurse or an agency that is state certified. If they're not state certified, we can't reimburse you. It's not because we want to drive up costs. We want to make sure that whoever is providing you care has the proper certification and training and qualifications. The newspapers and the TV stations periodically have reports of elderly people whose life savings are cleaned out, or whose valuable silver or artwork has been taken by someone they hired to help take care of them. That nice kid next door that helps you take in the groceries when you come back from the store and get your confidence, may come at some point and say, I'll pay your bills for you. Just sign a few checks and then I'll pay your bills. Well, the next thing you know, your checks are bouncing because that nice young fellow next door cleaned out your bank account and is long gone. If that's the case, you got to track them down. If it was a certified aid or agency, you can, you have legal recourse, and with an agency, you can sue them and get a substantial, potentially substantial reward. There was an agency out here by me 15, 20 years ago that happened to, and they no longer provide the aid services, they just do training because they couldn't recover financially from the hit they took for one of their aides cleaning out a client. So we're going to reimburse 80% of your costs up to $10,000 a year, $30,000 lifetime, and then the retiree chapter will automatically kick in 20% of what we pay. So you've got $12,000 a year, $36,000 lifetime, and that's per person. It's not family, it's not just you, it's for you and or a dependent. We talked about the stop loss benefit when we were talking about the pension deductions, prescription drug copays. For those who are non-Medicare, we reimburse 80% of your prescription copays after $100 deductible, and the chapter kicks in 20%. Express Scripts is supposed to mail every quarter a listing of your prescription utilization. And we ask you to save those up throughout the year. And at the end of the year, send us copies. Never send us the originals because you know the post office will lose yours. So make copies, mail them into the office. We get data from GHI, so we match it up with your ID, and we do the claims fairly quickly, and then the chapter comes at the end of that month. When you're Medicare eligible, if you're in the GHI plan, you have to have met the physically, actually paid the out-of-pocket maximum, which in 2021 is $6,550. After that, we'll reimburse at 100% up to another $5,000 worth of costs. If you're in a Medicare plan other than the GHI enhanced plan, then we can reimburse like we did pre-Medicare, which is 80% after the $100 deductible with the chapter supplement. We have surviving spouse coverage. We do those copays no matter what plan they're in. We also provide your survivors, I believe it's on the next page here at the end, but we also provide your survivors welfare fund benefits free of charge for 5 years. After that 5 years, they can purchase the benefits like Cobra for Life. This year, it's just over $65 a month, and that would preserve all of the benefits here in the green column for that survivor, as long as they would want to pay. On the second page here of the benefits, we've got the supplemental medical benefit. This is greatly enhanced from what we have as an active member. We're not paying an incredible amount for prescription drugs, so we're able to cover these additional benefits for you. So basically, supplemental medical is 80% after $100 annual deductible, supplemental to whatever health plan you're in. And so we've got a number of services here. Surgery and anesthesia, pre-Medicare, GHI may not pay the entire bill for the surgery. Probably won't pay the cost for the anesthesia. Very few anesthesiologists participate with any health plan because they know you kind of need them for the surgery. So they figure that why should I take less? I'll charge the max and get everything I can. But for these two, after your primary, after GHI pays, we'll reimburse 80% of the balance. The next one is my second quiz question. I give you the assignment of the survivor information. My next assignment is give me something good that ends in oscopy. Because we call them diagnostic invasive procedures. Examples are colonoscopies, bronchoscopies, endoscopies. It's a probe in a camera in a bodily opening. Pre-Medicare, there's often a copay or additional amount that's not picked up. I did this presentation for a group of retirees a couple of years ago, made the same comment. A couple of weeks later, a retiree sent me some papers that I'd asked for, and he included a clipping of an ad from his local hometown shopper, penny saver, whatever it was in his area. And it was from the chimney sweep offering a free chimnoscopy, which would be a look down the chimney. And he says, is this something good that ends in endoscopy? And I had to admit to him that yes, it was. And he got me. And so now, you know, that one's taken. I want something besides a chimnoscopy. It's something good that ends in endoscopy. We have a benefit for private duty nursing. This is a separate annual maximum of $10,000. The chapter will do another 20%, so you got $12,000. If your care requires something beyond a home health aide, then you may need a nurse, and so that's where this would come in. Where we often see this being used is Medicare eligible retirees. They're discharged from the hospital after a stay, and part of the aftercare is IV infusion of antibiotics 3 times a day for 10 days. Well, what happens is if you, with Medicare as your primary, if you get this done in an infusion center or in a hospital, Medicare pays, then GHI pays. If you have it done at home, Medicare doesn't pay. So we have worked with a number of the nursing agencies in the area to give us the real price, not the insurance price. And we will pay the, you know, we reimburse our 80% directly to them. And then you only are responsible for the 20%. Medications would go through your prescription benefit plan, since an antibiotic that's in liquid form is still a prescription medication. We've got radiation and chemotherapy. We're not going to pay for the medications, but sometimes there's a facility charge or you know, other type of charge related to that. The next one is, you know, a transportation benefit. One of the joys of maturing is that at some point we may not be able to use the subway or the bus or taxis to go back and forth to doctor appointments. We may need an emergency, an ambulance service. So with a doctor's note, we can reimburse at 80% up to $2,500 for that. Sometimes emergency ambulance isn't fully covered by the basic health plan for whatever reason. Non-emergency ambulance, let's say you've been in the hospital and now you're being transported to a rehabilitation or a skilled nursing facility, nobody ever pays for that. So we would reimburse 80% of that up to $2,500. If you're undergoing chemotherapy or you develop alopecia, we'll reimburse at 80% up to $1,000 a year for wigs. Surgical stockings, portable toilet seats, we provide some reimbursement for those. Orthotics, we continue the orthotic benefit. We have that for you now as an active member. For active members, we reimburse at 80% up to $400 repair for 2 pairs after $150 deductible. For retirees, it's only fair that we keep that benefit going for you. So since the deductible is only $100, it's a little bit better benefit. You still will reimburse up to $400 a pair for 2 pair a year per person. We just want to see a copy of the doctor's prescription and then the itemized receipt for the custom orthotics. This is not Dr. Scholl's gelling pads or anything. This is regular, you know, orthotic appliances that are made specifically for you.
Doug, is that any doctor who does the orthotics?
Yes,
Okay,
yeah, no, it's, because the GHI doesn't cover it. So this is just something that we fill in. We tried to fill in where there are gaps. And so, podiatrist, whoever would be available to fill that out for you, or you would see for that.
Oh, so basically, if I have some custom-made orthotics, which was done 2 years ago, I could have just sent you that receipt and I could have been reimbursed for that.
Yeah, but you know what? I'll make a special deal with you
Yeah,
in front of 17 of our closest friends.
right.
Send me the receipt now and I'll get it paid for you.
Okay, I have to find it. I'm sure I have it and,
Okay, I'm sure you do too. You're a
yeah.
great, all good school administrators have paper.
Yes. And,
It's a matter of finding it.
but no, I will find it definitely because
Okay.
it was really a serious issue.
Right.
And you also mentioned that surgical stockings, like for example, if I have a procedure on my veins and I pay whatever, $30, $50, $100 for those stockings, it's also going to be reimbursed by CSA?
As a retiree, yes,
Only as a retiree?
only as a
Okay.
retiree. Yep.
And last question, when you finish, I would like to get clarification again one more time on surgery, anesthesia, diagnostic, invasive procedures,
Right.
as colonoscopy and bronchoscopy. If I'm a retired person, but I don't have Medicare yet, so anesthesia or is not going to be covered at all, or you
No,
cover all
it'll be partially covered.
and partially it's out of my pocket?
Yes, and the out of pocket will reimburse 80% of what's out of your pocket.
Okay, so it's partially covered by insurance or may not be at all.
No, it's partially covered. They cover, they do a small amount.
They do small amount.
Yeah.
The rest of it, you cover 80% of the remaining.
Right.
And whatever is left, 20% comes out of my
Well,
pocket.
Yep,
Okay, and that also can go towards major medical, whatever,
yeah, yes,
catastrophic.
whatever the out of pocket is counts towards the stop loss benefit.
Okay, thanks.
Yep. So you can go, you can come to the next presentation. You've got it.
So the orthotics is for any member of the family?
Any member of the family, yes.
I didn't know about that. So, I filled a couple of prescriptions for the orthotics.
Okay, how far back?
A few years. The most recent was 2 years ago. And
I
then
can do, if you can find the receipt for 2 years ago, I'll do that. When you send them in, those who are sending them in, put a note on it saying Doug said he'd pay this. Because I don't see every claim and the staff sometimes doesn't understand what I'm trying to do.
okay, and that's before retirement. Now that's covered.
No, we cover them. It's $150 deductible, and then we pay 80% up to a max of $400.
Oh wow!
So the deductible goes to only $100 when you retire.
Wow, I didn't know because they cost like $700 or
Yeah,
so.
yeah. So we'll get you something back.
Okay, thank you.
Okay.
That's pretty sad. I have never once submitted in 32 years a copay. Never once submitted any
No?
copay bills. And Chris Ogno yells at me every time I see him.
Oh, okay. Well, see,
So we can, if our copay exceeds what, $1,000 a year,
well, it's not a copay. It's the out of pocket. It's using non-participating providers. You go to a doctor and they charge you a $15 copay, we're not going to reimburse that. But
Okay.
you go to a non-participating provider and they charge you $300 and you get back $39, that $261 we'll consider for the stop loss benefit.
Okay, and how much should it be accumulated after $1,000? You will reimburse, right?
Yeah, as a retiree, after $1,000, we'll start reimbursing.
And as not retiree?
As an active member, it was after $1,500.
Okay, thanks.
Okay, just a couple more here. We have a therapy benefit, physical therapy, speech, occupational therapy, and counseling. We used to just do physical therapy and cover 20 visits. But Medicare changed from visits to dollar amount several years ago. And by the time people maxed out on the Medicare benefit, it was more than 20 visits. So back in, it's all the way back then, 2015, we modified this, brought it up to more current standards. And so what it now says is, once your primary coverage notifies you they're not paying any more physical therapy, we'll reimburse your physical therapy bills at 80% up to a maximum reimbursement of $2,000. We also expanded it to include speech therapy and occupational therapy. The thought being that if you have a stroke, the physical part is one thing, but often strokes affect speech. So you need to learn how to talk again. With occupational therapy, you may need to learn how to feed yourself or write your name or whatever it may be. So we wanted to include all of those. Medicare now includes a little bit of counseling, end of life counseling and all. So we can put some counseling in here. If it's more than what this is, we put it through the stop loss benefit. And the newest benefit we put in, this has been in about 4 years now, is acupuncture. We had an awful lot of retirees coming to us asking us to cover acupuncture. They found it very useful in alleviating chronic pain. And this is when, just about the time that everybody woke up and realized that opioid addiction also severely affected, older people too. Those who were in chronic pain got hooked on OxyContin just as well as the kids. So we put this in initially for 18 visits. After 2 years, we doubled the visits, but we put the maximum allowable charge of $100 on. We found some acupuncturists charging $300 a visit, some charging $80. So we figured, let's take $100. It seemed to be an average and a median number. So yeah, you have 36 visits. We'll allow $100 a visit, and we'll give you back 80% of that. The chapter will give you 20% of our 80. So for every visit, you're going to get $96 back for your acupuncture.
Doug, since
Yes.
you mentioned acupuncture, so
Mhm.
currently it's more than acupuncture, people are using laser treatment. Will you consider it at some point, like laser treatment?
At some point we'll take a look at that.
Yeah, okay.
Doug, I have a question about the acupuncture.
Okay,
So, like for chronic back pain, right?
right.
So we have to pay out of our pocket and then we send you the receipts. Is that how it works?
That's how it works.
Okay, thank you.
Yeah.
But you won't do it for laser treatment, not yet.
No,
Not yet. So
yet.
even if it exceeds $1,500 of treatment.
Probably not. I'd have to get a description of what the procedure was and have our consultants review it.
Okay, thanks.
Okay, the last thing on here, hospital deductible. If you're in GHI Blue Cross, there's a $300 per admission deductible, which as a retiree is reimbursable at 80%. So when you're in the hospital, if that's the first claim of the year, we take our $100 deductible, give you back 80% or $160. If you're in again, or if you've already met the deductible, we send you the check for $240.
Doug,
Yeah.
sorry, Doug. Did you say that acupuncture is also covered now, or that's only for retirees?
Only for retirees.
Okay, thank you.
Yep. If you're in an HMO like HIP, all of these things we just talked about are covered 100%. So only for HIP HMO, if you're in that plan, we'll reimburse the copays after $100. We'll reimburse 80% of your copays. Those are the only copays that we actually reimburse. The extended hospitalization benefit shown here, this is for those in the GHI senior care. When we looked at the rate for that was $151.30. And I said that your drug cost would be $150.30. The other dollar is this extended hospital benefit. And this has been for the last probably at least 20 years. The city has billed us. We have paid this for our retirees in the GHI senior care plan. so that they're free to go and get whatever prescription drug benefit they want.
Doug, I'm sorry, I have a question.
Don't be sorry,
It-
that's why
it's
we're
a-
here.
It's about the office visit co-pays once you retire.
Right,
You say that you reimburse members for that?
if they're in an HMO,
If they're in like
if they're in like HIP.
oh, okay, so not for the Medicare people.
No, not for the Medicare people. Well, if you're Medicare HIP, yes.
Or
But,
if you're Medicare and Emblem Health, no.
right,
Okay, okay, thank you.
yep. And like we said before, the survivors, 5 years free of charge. And after that, they can purchase it. Surviving spouse needs to be a member of the retiree chapter. They'll figure out an amount and bill either monthly or annually to maintain all these benefits, if you predecease them. So I think I ran out of things to say. Let me see what chat comments are.
A question, when you say Medicare eligible and Medicare coverage, we're talking about Medicare Part A and Part B, both?
Yeah, Medicare, the age of eligibility for Medicare is 65. Medicare Part A, you do not pay for. As long as you've paid into Social Security for 10 years, Medicare Part A is free. That's part of your Social Security entitlement. Medicare Part B is what you pay for. That's also normally you're eligible and start taking Medicare at age 65. The Medicare regulations, however, say that if you are still working or covered by someone who is still working, for an employer with more than 20 employees, then they are secondary. So there's no need to spend hundreds of dollars a month on Medicare Part B while you are still working, or for your spouse to spend the money while you're still working. When you get ready to retire, that's when you need to go into Part B and when you need to fill out that request for employment information form.
And Part B will pay for doctor's visit and hospital, both.
Doctors and labs.
Okay, and Part A?
Part A covers hospitals and rehabilitation facilities.
Thanks.
Okay, let's see. Okay. What's the best individual and family plans for non-Medicare? 90% of our members are in the GHI CVP plan because the only costs are the prescription drug rider. And if you're in Greater New York, yeah, you can probably find a doctor with no trouble. Okay. How do you get off your husband's health insurance and get on my own? Send me an email, we'll work on that. I don't want to take the time here. If you want to get a pension voucher, contact the union. If you want to do it by email, just email membership@csa-nyc.org because they're the ones who send the vouchers out. Indicate you want the pension voucher. And they should reply and you should get it within a day or two. I'll check on where it needs to go for you, Rebecca. Okay. I knew that was going to come up. I just didn't know where, you know. Who's Denise?
You know Denise. She's your
Oh, Denise. Oh, Denise. Yes,
Yes.
Denise. Okay. Okay. Yeah, have her email me and we'll figure it out. I'll go to OLR and figure that out because you guys are unique.
I know. Thank you.
Yeah, I didn't say different. I said unique. I'm going to learn how to speak Spanish by reading your newsletters. I took Spanish in college, but that was but I only did it because I'd had 3 years of French in high school, and I didn't want to work that hard satisfying the language requirements. So I figured I'd take beginning French. And I had an expatriate Cuban lawyer who'd gone to Boston, learned how to speak English, who was in Western Pennsylvania teaching Spanish.
Very nice.
But it was a lot of fun. Then they changed the requirements and I could take a culture course. So I took a French culture course the next year. So
Yeah. Well, that's because we have a Spanish speaking intern this year. It's not my work, so.
Well, probably the population enjoys it.
Yes, very much so.
Yeah, okay. Okay, can anybody else got anything? I'm here as long as you have questions. If anything pops up and you think, you know my email. In terms of our operations, we were off today, so I've got a bunch of phone calls to return tomorrow, but we have all of our staff back in the office now since May 3rd. So calls are not going to voice messages and having to be returned, and then nobody's there, or it goes to their voicemail. So from 8:30 to 4:30, if you call, somebody should answer the phone, and we should be able to help take care of your problems and get back to as much of a normal operation as we can.
Well, thank you very much. This was very informative. Thank you.
Good. I'm glad it was a good use of your time. I hate to waste people's time. And like I say, anything you need, we're here to support you. I'm in awe of what you do and what you've done in the last year plus. And we're just here to do whatever we can to help it make it a little easier. And as it comes time to retire, we want to make sure we make it as easy for you in transitioning. And it's a different animal when you do it by email than when you can actually go in somewhere and do it. And so we try to help you out as best we can. And if things don't make sense, they probably aren't right. So let us know, and we'll help you get the correct information and cut through some of the red tape.
Thanks a lot. How can we get the recording of this presentation?
I'll be posting it on the website shortly.
Mm-hmm.
And
CSA welfare.
No, on the welfare fund, csaws.org. Yeah.
Mm-hmm.
I'll post it there because we're talking about more current things than the one I did in January. The pension deductions were updated in March, and so I'll post it there, and then you'll be able. I'll send an email to an email blast to everybody when it's available. I've got a retiree session I did yet. Well, let's stop this now. Hang on.